Now let's see a very rare pathology, which is which is by birth. See the abdomen of the patient. His age is 13 years, and now he has presented with the PUO because of socio-economic conditions. He could not visit any proper specialist, neither has any other ultrasound or investigative procedure been performed on this patient. Now you see that the laxity of the abdominal wall, which is bulging laterally on the right side. Here you see, here it is bulging, this area is bulging like a hernia. Here you see there is a bulge, and this is all bulge. And if you see that his abdomen, total abdomen up to the pelvic region is seen showing humps and bumps. These areas are again protuberant areas at the abdominal region, and this is the lateral side of the abdomen. Here again you see there is a bulge in this side, on the left side. This is a bulge. Here again you see a bulge, and this patient is presenting with this complaint along with PUO, and let's see what we get on the ultrasound. Beta Siddha operation. His growth is not that compromised as would one expect with this sort of situation. Now ultrasound shows Siddha beta lately. That the kidney is significantly dilated. All the calyces are dilated minimal to rather massively, with thinning of the parenchyma in this location. This is the pelvis of the kidney. You can see floating low-level echoes in this dilated pelvis. You can see that these echoes of a dilated pelvis. Now the pelvis is dilated up to 55 millimeters. More than 7 is considered as normal. Okay. So this is the dilated pelvis with floating echogenic areas, material echoes seen within it, as well as in the dilated calyces of the kidney. You see, these are the upper pole calyces. You can see the movement. See the movement in this region. And the parenchyma in this region measures at the mid-region, anterior mid-region, 6.5 millimeters, and at the upper pole measures 10.5, and here the echogenicity is normal. This is the liver. This is the upper pole of the right kidney, and here you can see that all the calyces are dilated, upper, mid, and the lower. Now this is the situation on the right side, and the kidney measures 14.6 centimeters in length which is enlarged, and 7 centimeter in anterior posterior diameter. More than 5 is considered as enlarged size. Along with it, we did see the dilated pelvis. Here it is. Pelvis is dilated and there are echoes within it. So this is the kidney. This is the lower pole, mid region, upper pole, that of the right kidney, and this is the pelvis of the right kidney. Let's take a measurement again. 14.7 in length and rather 7 centimeter in anterior posterior diameter, and this is the right kidney that we are seeing. Now let's move on to the left kidney. Now this is the spleen. This area is the spleen. This is the upper pole of the left kidney. As you can see, this is the source muscle. This is the source muscle, and the kidney is gliding over it. This is the upper pole. This is the mid region, this area, mid region, and this is the lower pole. Okay. So all the calyces are dilated, and the degree of dilation is massive in this, because you don't see any parenchyma. Total parenchyma at all regions is thinned out, and there are floating echoes in this kidney as well. Floating echoes, low level echoes can be seen in this kidney, as we saw in the right kidney. These are the low level echoes. Normally, if it is not an infective case, or there is no bleed, we see the calyces in hydronephrosis because of nephrolithiasis will be as black as this, until and unless it is complicated. Okay, now what is the measurement of this kidney? See, this kidney, the left kidney, measures approximately 13.7 centimeter in length, and approximately again 6.9 centimeter in anterior posterior diameter. Again, this is an enlarged kidney. Where is the pelvis? Now this is the pelvic region. This is the pelvis. This area. This is the pelvis, and it measures 3.1 centimeters. So this is the right kidney. Left kidney. Massively dilated, thinned out parenchyma. No calcification seen in both kidneys, and the degree of obstruction or dilation of the calyces is more on the left side compared to the right side. Now this is the left kidney. Proceeding a bit further now, let us go to the urinary bladder. See the urinary bladder. This is the urinary bladder. and the urinary bladder is full of echoes. This is the bladder wall. Here it is sausage shaped, full of echoes in transverse section. In longitudinal section, we see a huge cystic area that extends from just below the umbilical region up to the pelvic region, and these are in fact, this is the dilated renal pelvis, I show you, which is full of echoes. Both the pelvises are dilated. You see the movement of the echoes within it, filled with low level echoes. No calcification is seen. And this is the distal ureter. This is the distal ureter, which is full of echoes, left-sided, and this is the distal ureter type on the right side, as you can see here. If you see that this is the dilated cystic structure with dependent region, floating low-level echoes, no calcification, no septa, no solid element, no calcification is seen. This is the dilated right ureter, distal ureter. This is the dilated left ureter. This is the left ureter, and see the degree of dilation. This right ureter is dilated up to 22 mm, and the left ureter is dilated up to 21 millimeters. And this is the dilated pelvis of the kidney, and it can also be representative of distended bladder. We can't rule out that possibility. I'll have to ask the patient to go. This is now what you are seeing is in fact a distended urinary bladder. This is not a pelvis. This is not renal pelvis. When I was intentionally saying you that this is the pelvis, so that if something comes in your mind that well, both pelvises are dilated, where are they separated, and I have shown you the pelvis initially. So in this, what is this then? This is the urinary bladder. This is the over-distended urinary bladder. This is the over-distended urinary bladder, extending here umbilicus above, just below the right. Just below the epigastric region, and then you see it has an opening down here. You see, this is a small opening, and this is the cystic area. This is the urinary bladder, not pelvis, remember. And now, when I will ask the patient to micturate, let's see if this size of this urinary bladder decreases or it does not decrease. Now, this finding is seen most commonly in male patients. This one, just this one, distended bladder, and note the small dilated posterior wall of the bladder, and this can be seen in the patients with posterior urethral valves. And the other possibility can be a development of a diverticulum, and the echoes are traveling within this ecophyll cystic area and the bladder above. They are communicating with each other. You see this. They are not separate structures. Now, there is one other thing of importance to show you, which is that what is the status of the ureter. Here you will see that the ureters give you a dilated, convoluted appearance. Now this is the ureter. Remember, this is the ureter. It gives you a convoluted appearance. All this. This is the right ureter, giving you a convoluted appearance. Yes, this is all ureter, right ureter. And on the left side, again you will see the same thing. Here you see again the convolution of the ureters. Convoluted ureters. So dilated, convoluted ureters with lax anterior abdominal wall and this distended urinary over-distended urinary bladder filled with low-level echoes along with bilateral massive hydronephrosis compromising the thickness of the parenchyma with no calcifications, however, with here you see this is the pancreas, this is the pancreas, this is the splenic vein, this is the superior mesenteric artery, and this is the aorta. This is the right kidney in transverse, this is the left kidney in transverse section. So with lax abdominal wall, with all these findings, this case is a case of Prune belly syndrome. Right kidney seal, this is the left kidney, convoluted ureters, ureter, over-distended urinary bladder, filled with echoes, floating echoes, and dilated echo-filled ureters. Thank you very much. Now this is again a rescan with continuation rather of the same patient after micturition. Now you can say this is the post-micturiration. Post-micturiration, you can see that these are the ureters giving you a convoluted appearance. So this is the right side, right ureter, and over here left side will give you the same appearance, same convoluted appearance. Yeah, here we are. This is the convoluted ureter, left side, and this is the urinary bladder. See the dependent region floating echoes in it. So the post-micturiation residual volume is raised, absolutely no difference, and this appears to be that the post-micturition will be more than 1.5 liters. So the post-micturition, you can see the status of the urinary bladder. Now another important thing to see if this is a Prune belly syndrome, note that the anterior abdominal wall fat is not there. Directly skin, little bit of subcutaneous. This is the skin. Now I am starting from the left upper abdominal quadrant and will be moving the probe down up to the pelvic region. see that this is the skin, anterior abdominal wall skin, and this is the small amount of subcutaneous tissue. And the subcutaneous tissue, if you keep your view on this side, it remains the same. So the subcutaneous fat is now on the right side, starting from the right hypochondrium, coming down up to the pelvic region. You see that the anterior abdominal fat is too less as compared to the normal. So this is a case of Prune belly syndrome. Thank you.